Since the transition of the NIHR Clinical Research Network in 2014, which included the forming of local clinical research networks, Greater Manchester has recruited over 500,000 participants to over 3,850 studies. This is in no small part down to the dedication and hard work shown by our specialty leads. From helping to develop our partner organisations' portfolios to developing study design both locally and nationally, your work has changed the landscape of research delivery enormously for the better. We at the Local Clinical Research Network here in Greater Manchester are extremely thankful for all your efforts.
We have seen great feats of innovation, including research breakthroughs in dementia and neurodegeneration, with the licensing of the first Alzheimer's drug in 20 years, aducanumab, and a diagnostic biomarker breakthrough for the early diagnosis of Parkinson's disease. There has been numerous novel ways in which research has been delivered, including the utilisation of St John's Ambulance in the children's specialty, enabling greater reach across our boroughs. Trainees have worked innovatively to completely design and successfully deliver an ENT study, and the Trainee Emergency Research Network TURN has been instrumental in the delivery of Homegrown Research Shed, which has recruited to studies throughout the pandemic and increased collaboration with pre-hospital settings.
We have seen many high flyers across our specialties since 2014, including numerous world, EU and UK firsts, with over 50 of these in cancer specialty studies, and more than 10 studies in the last 5 years for ophthalmology. Metabolic and endocrine and stroke have also both successfully entered UK first patients too. We have a number of consistent top recruiters in renal and diabetes who regularly sit within the top 5 highest recruiting regions alongside cardiovascular and neurology, with anaesthesia also recruiting more than all of the regions by population since 2014. Most recently, we've seen significant growth in respiratory over the past few years, having delivered the largest real-world study in the Salford Lung Study and their recent work during the pandemic. As part of the recovery trial on our infection portfolio, the first participant to receive convalescent plasma was recruited in Greater Manchester. Dermatology also contributed to the COVID-19 effort by leading on a study to define IMID susceptibility in COVID-19 severe cases. To date, more than 600 participants have been recruited in Greater Manchester. Also during this time, haematology recorded their best recruiting year in 2020 by finishing 3rd overall.
Critical care and gastroenterology are top performers nationally, offering the most unwell patients the best evidence-based care. Hepatology and surgery have both risen to the top from the bottom of the table. Genetics is gathering momentum, fantastic news as they recruit into the first commercial trial. MSK and dermatology, both second place, deliver across primary and secondary care. Primary care has increased the number of research active GPs, which has risen from 17 to 31% since the pandemic started. The smaller specialties are doing fab. Ageing has increased the number of PIs across Greater Manchester, delivering research across care home and social care settings. And public health has increased the number of studies from 1 to 5 per year. Whereas oral and dental have collected data in schools and community dental practices.
So, as our research landscape continues to change and our number of specialties increases from 30 to 31 with the inclusion of social care research, we would again like to thank you for all your hard work. If the next 8 years are anything like the last 8, then the research needs of the people of Greater Manchester are in very safe hands.